As the sports world stops due to the outbreak of COVID-19, former Titan Myron Rolle finds himself right in the middle of the action once again. The football player turned neurosurgery resident is on the front lines, hoping to play a role in the most important victory of his life. Myron Rolle's traded in his face mask for a surgical mask.
Football was great, but I always knew that medicine was going to be the next phase, the second chapter.
Chapter 2 comes as no surprise to anyone who's followed Rolle's story. At All-American safety at Florida State, he delayed his entry into the NFL draft to become a Rhodes Scholar at Oxford. After being selected by the Titans in the 6th round of the 2010 draft, Rolle played 2 seasons in Tennessee. Then, after failing to make an active roster in 2012, he chose to hang up the pads for good and head to medical school.
I just kept this parallel track of football and academics going while I was competing. And then I just wanted football to sort of take me as far as it could. And once it did, and once I got all of it out of my body, I said, let's move into medicine so that we can still contribute to society and I can still live this lifelong dream of fixing people and helping people.
Rolle's pursuit of that dream led him to Massachusetts General Hospital, where he's a third-year neurosurgery resident and one of the places seeing the biggest influx of patients suffering from COVID-19.
It's incredibly concerning when you walk into a patient's room who is on droplet precautions, contact plus precautions, airborne precautions. You have to put on all the masks and the gowns, put that on properly, and then take it off properly.
While the hospital's taking in hundreds of patients daily that have contracted the virus, Rolle and the neurosurgery team continue to perform life-saving surgeries of their own while trying to help the hospital prepare for the coming surge of the outbreak.
We go in and we operate, and our operations last a long time. They're under anesthesia. They need post-op scans. We're trying to do the best we can to sort of fast-track these patients to get them out of the hospital. 1, we don't want them to get sick, and 2, we want to free up our bed space.
As he walks into the hospital each day, Rolle still draws upon the skills he gained on the football field.
Football has helped me so many ways. 1, it's a team sport to be a neurosurgery resident. You have to be a team player and learn how to work within a team environment. Communication is obviously very important. Everyone needs to be on the same page. Just like when I was a safety, I was manning the defense and calling out down and distance and trying to be proactive on the field. You have to be proactive as a leader in the operating room. And then I think the biggest crossover trait that's helped me the most has been mitigating pressure. I've used that from football now to medicine.
Rolle's seen enough from this virus and all his years in medicine to know he's not as invincible as he once thought on the football field, but says he's confident that with a little help from the public in stopping the spread, he and his medical teammates from around the country will win this battle.
My advice would just be, pay attention, be careful, protect yourself, protect your family, and then we can get through it. I think we have some brilliant women and men who are studying this and working incredibly hard in laboratories, finding novel ways to fix a novel problem. It will happen.
The Myron Rolle Foundation was founded to help children in vulnerable populations and teach them about health work. For more information, you can visit rollefoundation.org.